Welcome to AIG Talks program. Today we are going to discuss about the coronavirus, which has caused a lot of panic among all the population in the world. So I have today Dr. Pragathi, who is the head of the infectious disease, and Dr. Vishwanath, who is the head of the Pulmonology department of AIG Hospitals. Both of us will explain and then answer many questions about coronavirus. Welcome, Dr. Vishwanath and Pragathi. So today we'll discuss a little bit about coronavirus and try to see how much we can remove the panic which is spreading among the people. So to start with, we all know that coronavirus has been existing for quite a long time, and they have caused several epidemics earlier in the form of MERS and SARS. So can you elaborate a little bit on coronavirus?
So coronaviruses are a large family of viruses which can infect both humans and as well as animals. So the previous epidemics caused by the SARS and the MERS were similar ones, which caused respiratory illnesses, the severe acute respiratory distress syndrome. And this current strain which is causing the epidemic appears to be a novel strain which has not been previously identified, and the symptoms may vary from mild flu-like illness to severe acute respiratory distress syndrome.
So there have been several strains evolving from the basic coronaviruses. And MERS and SARS have been different strains of the same virus, and how did they evolve?
So it is quite common for these respiratory viruses to mutate on and off, and the epidemics caused by SARS and MERS were similar ones. So these are it's usually believed that bats serve as the reservoirs for a large group of viruses because of their unique immunity to harbor many viruses. And so all these three viruses are believed to have originated from bats, which appear to be the primary reservoirs, and then they would have spread to some infected animals, and from then to humans, and now these are circulating from person to person.
So most likely possibility of the current virus is also a mutation theory, or is there any other theory for the evolution of such a virulent strain?
This appears to be the most popular theory, though there are other theories like bioweapon and all, but no evidence anything in that regard.
So current evidence suggests that it's most likely to be the mutation of the earlier coronaviruses, and which has evolved into a very new variety of virus which is causing significant influenza-like symptoms, and in certain susceptible patients is causing more serious respiratory symptoms, which is causing the panic, right?
Yes, because these, if we analyze the outbreak, the initial cases which were infected were all having some link to these large seafood markets or animal markets, but then suggesting some animal to human spread. But as the disease spread and became a pandemic now, we see that it's mainly transmitted between humans. There is no link of the cases to any animal markets or seafood markets.
So primary reservoir has been bat, and from bats it has spread to animals, and then by consuming that animal it has spread to the human, and then from human to human. Is that the general theory which is evolving now?
Not only consuming the animal, it could be just direct or indirect contact with the animal.
So in that sense it is a zoonotic origin, because MERS was supposed to have evolved from camel, SARS from cat, so it is some sort of a zoonotic origin?
A zoonotic disease. It spreads from animals to humans. If we see the SARS, that was from civet cats, and if we take the MERS, that was contact with the dromedaриan camels, and here we still can't identify the exact animal host for it, but most likely from animals to humans.
So it's a live animal market in Wuhan, which is the primary source as believed by many researchers. So do you think that is the reason?
Yes.
And probably the bats as reservoir have spread to the animals, and then they appeared in the animal market, wild animal market, and from there it spread to human.
Yes.
Is there any credence for this bioweapon theory, Dr. Vishwanath?
I don't think there is any credence for that. The main transmission from animals to humans is the most plausible explanation as of today.
And mutation as a primary...
the mutation and then spread of virus from the animals to humans, and then now human to human transmission seems to be the most scientific and plausible explanation for the spread of coronavirus among different countries as of today.
So earlier epidemics caused by coronavirus, that is MERS and SARS, what was the general measures which were taken and they were controlled very well? How they presented and how they were controlled at that time?
In 2002 to 2003, this coronavirus has caused SARS actually, severe acute respiratory distress syndrome. It was mainly, these cases were mainly located in China actually, and then the death rate was somewhere close to 15% actually. And then the isolation measures were very effective, and then they did not spread to different countries. And subsequently in 2014 or 15, we had this MERS, which originated from the Middle East countries actually, and the death rate was again 35%. So that time also it did not become a pandemic at that time, and it was contained to those countries in which it originated from. However, here in this current pandemic of coronavirus which we are seeing, it has spread to more than 110 countries, and more than 1 lakh of population are affected in this because of this coronavirus infection.
The mortality in SARS and MERS were also seen to be higher in the susceptible patients, or it was the general population which had higher mortality?
Yeah, in SARS and MERS also the mortality was higher among susceptible population. For the matter, any respiratory illness or pneumonia or ARDS can cause more mortality among patients who have previous cardiac, lung or any other comorbid conditions or illness.
What were the measures which could effectively control that within a short span of epidemic for MERS and SARS?
So predominantly isolation, quarantine, these were the measures which were used at that time. Even they didn't have any pharmacotherapy, specific pharmacotherapy for their use actually. And then the mortality was very high in this. Maybe because the mortality was high, the spread rate, they did not spread. Self-restricted, and then it did not spread to the outside.
Okay.
But here the mortality is less. That is the reason why I think it might have spread to different countries.
So when you said mortality is less, so most of the people affected are having mild flu-like symptoms, and only susceptible patients are having severe disease, or what is the mode of presentation for the current SARS?
So in the current SARS actually, if you look at the data which has come up from China and different countries, 85% of the cases are generally very mild. They'll have mild cough, cold and flu-like symptoms. Approximately 15% of the patients require hospitalization, out of which 5% of the patients require actually mechanical ventilation or some kind of ventilatory support to maintain their oxygen level. And out of them again, the mortality is seen to be somewhere between 2 to 3%.
So what is the usual initial presentation? It was routine flu-like symptoms, fever, body pains, leading on to more serious respiratory symptoms. Was presentation like that in most of the patients?
Yeah, routine presentation is just like in any kind of viral illness. They often present with cough, cold, sore throat, body pains, fatigue, malaise. Sometimes they can have loose motions and vomitings as well. But in subset of patients, they become very severe. They can cause pneumonia. These patients develop breathlessness. They cannot breathe well. Their oxygen levels drop down. Sometimes their blood pressure can go low. If it involves the heart as well, actually, it's called myocarditis, viral myocarditis.
So those are all occurring in susceptible patients, or even at young healthy adults? The more serious respiratory complications were seen more in susceptible patients or young healthy adults?
So pneumonia can happen in anyone, even it can happen in young individuals also. But the deaths which have been seen because of coronavirus have mainly been seen in patients who are more than 55 to 60 years of age, and people with conditions like hypertension, chronic obstructive pulmonary disease or any other lung disease, heart failure, liver diseases, and patients on immunosuppressive drugs. These are the patients in which the death rate will be high. Pneumonia can happen in anyone.
So the terminal events are generally ARDS leading to ventilatory type 1 failure or type 2 failure. Respiratory failure?
So any pneumonia, when it is very severe, it leads to a condition called as acute respiratory distress syndrome. That is the main cause of death in these patients where their oxygen levels become very low. It's called type 1 respiratory failure. Sometimes these patients can also have carbon dioxide retention also. That is called as type 2 respiratory failure. These are all technical terms, but the most important word or term to remember is acute respiratory distress syndrome. Sometimes they can have shock actually, where the blood pressure is very low, renal failure, kidney can shut down, and then arrhythmias can be there, where the pulse abnormalities can be there.
And they develop bacterial sepsis also in susceptible patients?
Yeah, these all patients can have susceptibility because their immunity is low. They are at risk of developing any bacterial infections and bacterial sepsis as well.
Okay. So Pragathi, what is this SARS, COVID can we explain the nomenclature, how these names have evolved, which organizations are giving these names to this disease?
So basically, when China declared the outbreak on December 31st, initially few names came up like the Wuhan virus, China virus and all that, and since it was a new strain of coronavirus, was also called as novel coronavirus. But then on February 11, 2020, WHO has announced an official name for the virus as SARS-CoV-2 because of its close resemblance to the virus which caused the previous SARS epidemic.
So initially it was called as some novel coronavirus or something, which was the name given by WHO, and later on they changed the name to SARS-CoV-2.
SARS-CoV-2. But then again, Wuhan virus or China virus may create some social stigma or discrimination in the public. So to avoid all that, following the best practices for nomenclature of newly diagnosed infectious diseases.
So which organization has given these names?
So the virus was named by the International Committee on Taxonomy of Viruses as SARS-CoV-2 19. And the disease caused by it by WHO as COVID-19 or coronavirus disease 19.
So currently used terminology is
COVID-19
as the disease name, and SARS-CoV-2 is the virus which is responsible for this, which is a group of coronavirus. So COVID-19 means because it has appeared in the year 19, the 19 is ordered, or is there any other
when the outbreak happened as 19.
So it is the year 19 when the outbreak happened, that is why it is given as COVID-19. Okay. So where is it now? Is it appearing to be spreading across the world? Is it becoming a pandemic or already announced as pandemic by WHO just recently?
Yeah, just recently on 12th of March, that is yesterday, the WHO has now declared it as a pandemic as it has involved more than 110 countries. So we call any disease as a pandemic when it involves the entire country or the continent or different parts of the world depending on the extensiveness of the disease, and now WHO has officially declared it as a pandemic.
Declaration of pandemic, does it attract any special resources, special methods of trying to contain it by WHO?
I think now we need to be on an alert and be prepared for the outbreak or epidemic. Even now only some countries are worst affected like China, South Korea, Italy, Japan, but now as it is spreading to the other countries, fatality is not so bad in the rest of the world, but then again we never know, so we need to be alert and prepared.
So what is the incidence now across the world and in India?
So till date more than 1 lakh confirmed cases have been reported across the world. Death rate also has been more than 4,500. And in India, 74 confirmed cases of coronavirus disease, and there was 1 death reported recently, and 3 or 4 cases have recovered. So that's the current status.
The percentage of death, it appears to be around 3 to 4% of the total population affected. Is it significant in terms of pandemic, or you think death rate is quite low when compared to SARS or MERS? Yeah,
absolutely. As you said, rightly said, the death rate is very less compared to SARS and MERS also. But the problem here is the spread is in more than 100 countries, and the number of population affected is also more than 1 lakh. Whereas in SARS and earlier SARS in 2002-3 and MERS, they were limited to a few thousands of people actually. That is the meaning. Though the death rate is less, the number of people affected are more, and more number of countries are affected. So in India, the first death has been reported yesterday, so which is again appearing to be in a very elderly person, 76 years old, with all comorbid conditions. So the basic thing appears to be the susceptibility of the patient. So can we elaborate on what are the susceptible conditions in which patients are likely to have more severe disease? One is the advanced age, more than 60 years of age, and then presence of high blood pressure, heart failure, a previous lung problem like smoking related disease like chronic obstructive pulmonary disease or interstitial lung disease, or patients are on immunosuppressive medications for different conditions like transplant or some kind of arthritis or some kind of autoimmune conditions. All these patients are more susceptible to thing. And also nutrition also plays an important role. If you are not eating well, if you are not maintaining your nutritional status well, you are at risk of infection. How much risk is there for a healthy young adult who is otherwise very healthy and then very fit?
So how much risk he carries when he develops a coronavirus infection?
So he will be one among that 85% which I have been telling you, that the chances of having a very mild disease are very high.
Okay. So Pragathi, what are the diagnostic tools we have? How do we diagnose this disease? And we all know that there are certain designated centers in every state which are decided by the government, where we are all sending the samples and then we are getting the test done. Can you explain exactly how the testing is done and what is the duration of the results, and then how soon we will have the access to the results?
So as soon as the outbreak was declared by China, CDC has come up with the diagnostic kit, that is RT-PCR test, which is done for the diagnosis of the disease by detecting the virus in the respiratory samples. Then this was distributed by WHO to different countries, and in India it was initially done only at National Institute of Virology, Pune, but now the government has identified 51 centers across the country where this testing is done. So the initial testing is done by RT-PCR, and if any case comes as positive, then the samples are sent to NIV Pune for genomic sequencing for confirmation.
So what is the time for the result, for the initial screening which happens in the local center, and what will be the time for the report to come from NIV?
So as of now, with the current patient load, it's being done in 2 to 3 days.
Both together?
Both together, yes. 1 day for the RT-PCR and
gene sequencing is done at
which goes to Pune, and both together in 2 to 3 days. If it's negative, it would be reported in a day, and if it's positive, then for confirmation,
they will send it for a confirmation test. So until the confirmatory test comes, should we panic that it is a serious threat? What is the sensitivity of the initial screening test?
So far, all the cases that have, except one in case of Telangana, so all those that have been tested positive by RT-PCR are confirmed as positive by gene sequencing as well. It's quite a sensitive test, RT-PCR, but again, as with any other PCR methods, it has got the limitation of detecting false positives.
So what is the role for serology? Again, we are doing serological tests in 1 or 2 weeks. So
yeah,
what is the role of serology?
Immediately on the first admission, and again 3 weeks after detection of the case. It's only for epidemiological surveillance basically. So for antibody detection.
It is not as a diagnostic
Not as
tool.
a diagnostic test.
What is the general presentation, and what are the criteria for admission? When we should be alerted that the patient really requires admission and requires more close supervision?
So as on today, all the patients, whether they have mild symptoms or moderate or severe symptoms, all these patients are admitted to the hospital. They are kept in isolation rooms or isolation wards depending upon the facilities which are available. But if a patient is sick, clinical judgment of the doctor will prevail over any of the parameters. And then if the patient is having a respiratory failure where the oxygen levels are low, and then they are looking at the cardiac status of the patient, blood pressure being low, and other blood parameters like lactate dehydrogenase, which can be elevated in sick cases, lymphopenia, sometimes ECG abnormalities, or pneumonia which is present on the X-ray or the CT scan, will prompt them to be kept in an isolation kind of ICU setup. And all these patients, when their oxygen levels are very low, are being provided and ventilator support, which could be a non-invasive ventilator support or invasive ventilator support.
Patients who have milder symptoms, like mild flu-like symptoms, still if they are found to be positive for the COVID-19 disease, though, then they have to be isolated, right? We are all sending them to Gandhi Hospital, or are there any other hospitals in Hyderabad which have been declared to admit the patients, and what are the criteria they are using for that?
No, as on today, only in Telangana, only Gandhi Hospital is allowed to admit cases of corona. Even they have mild disease, they are admitted in the hospital till they turn negative for this coronavirus infection. Maybe with the number of infections increasing, they might be giving permission to other institutions as well to accommodate more number of patients getting admitted.
Just to add on to that, the government has identified 20 other hospitals with medical colleges on all that very recently to accommodate these new cases.
They are in the process. They have not initiated it. Right now, they are all going to Gandhi Hospital.
Yes.
I believe they have created a nice isolation setup, and where the patient will be quarantined for about 1 to 14 days. Is that the period which the patient is being observed and watched?
So one is the time
For a milder symptoms patient, I know.
yeah, milder symptoms patients, once their symptoms resolve, they are tested for PCR again, and when they are testing 2 consecutive PCRs negative, then they are discharging these patients. And patients with active symptoms are still being kept in the hospital as long as they have active symptoms.
So most of the patients have significant respiratory symptoms, and we hear that it leads to viral pneumonia and eventually to ARDS. What exactly is ARDS, and how it evolves into a situation of ARDS?
So a lot of viruses and bacteria can cause pneumonia-like presentation. ARDS means when the pneumonia is very extensive, so that it is involving more than 50 to 60% of the lungs actually, and leading to a severely low oxygen levels, and without any presence of any other cardiac problems leading to this kind of problem. That kind of presentation is called as an acute respiratory distress syndrome actually. So in general, the success rate of ARDS is close to the tune of 60 to 70% in various settings in different countries. So similarly in coronavirus infections also, we guess that the success rate could be same among, compared to other kind of viral illness. Here we are seeing around 3% deaths in 100% case of coronaviral infections. Only
it is no different from ARDS caused by other viruses and other bacteria. So what will be the mode of approach and treatment for ARDS patient?
So currently, as of today, there are no pharmacological interventions which are available for treatment of coronavirus. However, you can give best supportive care like antibiotics to cover secondary bacterial infections, oxygenation, ventilatory support, and then in case of shock, medications to maintain the blood pressure. In case of different organ failures, like if there is a renal failure, dialysis needs to be provided. All these things need to be supported, given.
Most of them are supportive measures, as the complication appears, and we take that help and then do the treatment.
Yes.
So is there any role for, you said antibiotics, is there any direct role for antibiotics or antivirals in treatment of coronavirus, or it is just
Antibiotics do not have a direct role on coronavirus, or neither the antivirals have a role on coronavirus infections. It's mainly to cover antibiotics are mainly to cover secondary bacterial infections, which can happen in any kind of viral infections.
Different physicians have tried some anti-HIV medications to treat coronavirus. So has it been effective, or is it okay to start them?
They have been just started on a trial and error method. And however, the Ministry of Family and Health Welfare has issued guidelines saying that this HIV medication should not be used for the treatment of coronavirus because they lack strong evidence, and then these drugs might develop resistance to HIV in the future if you use them erratically and erroneously.
So with limited experience available, there is no such antiviral drug which is effective against this virus, right?
Yes.
Are there any other drugs like herbals or any other non-allopathic drugs which are effective against this?
Currently, again, there is no evidence for even other non-allopathic medications that they cause improvement or they cause cure of the virus.
And vaccination trials are on, we know, but how far is it away from really seeing light?
I think it might take some more time for us to get the vaccines, but still not.
Still not in the near future.
Yeah.
It cannot happen within months. Probably it will take at least.
There are some claims saying that there are going to be some coronavirus vaccines in the coming few months or so. We need to wait and watch as to whether they will come soon or not.
So what will be the discharge criteria? Once a patient has recovered after all these supportive therapies, so are there any specific criteria with which we could say that now, yes, patient can go home safe and he will not infect anybody else?
One thing is you should be clinically stable, not coughing, and all the parameters which we mentioned, the oxygenation, blood pressure, everything should be stable. And then once they are clinically stable, then these patients are tested again for this PCR test. And then if one PCR test comes negative, then they are subsequently subjected to the second PCR test. And if even the second test comes negative, then these patients can be discharged home.
So generally we said quarantine period of 14 days, but if a patient was gone to ARDS and then he has been sick and then he has been hospitalized for a longer time, so do you think they continue to harbor the virus for more than 14 days? This 14 days is very arbitrary, or it is definitely the lifespan of the virus is only 14 days?
Now, the incubation period of the virus ranges anywhere between 2 days to 14 days. So once the symptoms start again, as long as the symptoms are there for the patient, the viral replication, that means that the viral replication is still ongoing. So all these patients need to be quarantined, isolation for the time of the symptoms, not only 14 days plus the time duration which the
symptoms, and at least 2 times the test should be negative.
Yeah, 2 times
that is what
is
the current criteria.
Yeah, current criteria.
So are there any special precautions for them when they are discharged?
Again, even after discharge also, they should be asked for some days to come actually. They should not be asked to mingle with the people. And then if they have a cough, cold, then they should cover their mouth to see that the virus does not spread outside. And then to wash their hands very frequently. And the cough etiquette should be followed meticulously. They should be using a tissue to cover their mouth or nose when they are coughing or sneezing. Or they should cough on the forearm or on the sleeve actually, to make sure that they are not spreading the virus. If they are coughing into the hand, so they will go and touch the door handles, taps, everything with these contaminated hands, and then that leads to again spread of the viruses. So these all precautions should be taken. And then once they cough, actually they should avoid touching their nose, eyes, and everything. They should wash their hands and then touch.
So, Pragathi, you have put in a series of preventive measures at AIG Hospitals. Can you elaborate which are most effective? Self-quarantine or self-isolation appears to be a very effective method. So, how do we develop that awareness among the people who develop flu-like symptoms which are milder, and if they have tested positive or if they had travel history, how do they self-quarantine themselves?
So, people who are sick or who seem to have contact with any suspected cases can isolate themselves at home if the symptoms are mild, or if they have severe symptoms, then they should see a doctor and seek advice accordingly. So, if it is at home, first they should stay home, do not go to crowded places or infect others. And as Dr. Vishwanath already mentioned, they should follow all the cough etiquette. Whenever they cough, they should have a tissue with them and dispose it properly again into a trash can, or otherwise cough into their flexed elbow. And more important is frequent hand hygiene. They should wash their hands thoroughly with soap and water.
Hand wash is the primary,
most important.
Most important. Is there any superiority with hand rub versus soap and water?
So always washing hands with soap and water is the best method. It's superior over the hand rubs. And even when you are using hand rubs, we need to ensure that they are mainly alcohol-based hand rubs, having at least 60 to 70% alcohol. So there may be some chlorhexidine hand rubs available or other disinfectants, but the proportion of alcohol should be at least 60 to 70%.
So how often you have to use the hand rub?
So whenever a person coughs or sneezes or touches any contaminated surface, you should perform hand hygiene.
Does it spread through food?
The most common mode of transmission is through respiratory droplets. So we need to maintain a minimum distance of 1 meter from someone who is sick. And also it can spread through by touching the surfaces and objects that are contaminated with the secretions. But there is no evidence to say that it spreads by food, either refrigerated or frozen. But again, we should always follow the general food safety rules, like washing hands thoroughly before eating food and all that.
Can the virus survive on the surfaces or any fomites? By touching them, can it move to another person? So is there any role for disinfection of all the surfaces around the infected person?
Yes, it does spread by direct or indirect contact with the surfaces which have been contaminated. That is why it is advised that we frequently clean and disinfect the commonly touched surfaces like the door handles or the tables, computer keyboards, all that with normal household disinfectant sprays like the commonly used bleaching powder, or with alcohol-based disinfectants like Lysol or phenol.
To add to this point, hypochlorite containing solutions can also be used for the disinfection of surfaces.
The bleaching powder is...
Yeah.
So, there's a lot of controversy on the use of masks. So, is a surgical mask 100% foolproof to prevent spread from one person to another? Or are there any sensitive surgical masks, 2-layer, 3-layer, all this we hear? What is the difference between a 2-layered mask and a 3-layered mask, and how effective is it in preventing the spread of coronavirus?
Two-layered mask is only a barrier to prevent droplet spread, big droplets, but otherwise it does not filter out any aerosols or anything. It does not have the capacity to filter the airborne particles. Three-layered mask, it has a middle high density filter. It can filter about 70% of these airborne particles, and if any person is suffering from this flu-like symptoms, it is advisable to give this the sick person this three-layered mask. And healthy adults need not wear any mask. So unless those who are involved in the care of these suspected or confirmed cases of coronavirus disease.
What are the disadvantages of the face mask? Why it doesn't effectively control
It does not
the spread
fit
of the disease?
snugly. So there is a gap,
So there are a
and
lot of
again,
gaps from the sides
airborne
through which
particles
it
may enter through the gap.
And also it said that it can spread through the mucous membrane in the eyes.
Yes, there may be a splash or anything, and for that, I mean, if somebody, healthcare personnel is involved in the treatment of these cases, we need to wear a face shield. So, but we also have better masks like the N95, N99. The N95 again fits snugly to the face and filters out about 95% of all these airborne particles, particulate matter.
Okay.
And the N99 is even better, filtering about 99% of airborne particles. And the Vogue mask is another one which is available. It is also a type of N99 mask which can filter out all the 99% of airborne particles. Along with that, it can even filter the pollutants which are commonly prevalent in the air. So it's used as an anti-pollution mask as well.
So do we have to rush and buy N99 and N95 masks, or we could still take some other precautions short of that?
No, not at all. Even the CDC and WHO guidelines suggest that N95 or N99 are required only if there is any generation of aerosols, like during bronchoscopy procedures or when the patient is active, when they are doing suctioning. Only in such situations it is required by the healthcare personnel. Otherwise, for common people, there is no need for N95 masks.
To add to this point, people who are involved in cleaning of the surfaces, disinfection, surface should also wear N95 because they can raise droplets when they are cleaning and that they can get infected.
So wherever there is a place for emitting aerosols, that is the situation when you have to ideally wear a more protective mask like N95.
Healthcare person involved in the care of the patient and also the person who are involved in the cleaning and disinfection of these surfaces
Have to use
N95 masks.
So there is a tremendous shortage of masks across the city because people are just stocking that at home. So what we do? What we do in that situation? So can we use a conventional cloth mask? Will that have any protective effect?
No, not the cloth mask, but at least a three-layered mask is advisable.
Three-layered cloth mask? Or what you're talking about, a non-woven layer, a density filter, and an inside layer which actually absorbs the moisture. That is a conventional three-layer. So we need to have that kind of mask.
Yes.
So the inner layer will absorb all the sweat which comes, and the central one will actually filter the particulate matter. And the outer non-woven, which has 2.5 GSM, which actually reduces the splash coming into direct contact with the face. But there is a possibility that it can spread through the sides and through the mucous membrane. But to an extent of stopping the splash and the direct cough onto the face, it will definitely protect. So is that the message that we can give to everybody about the mask?
Yes, definitely. And again, I would say only if you're going in contact with a sick person, all this is required. Otherwise, if you're normal, healthy adults, there is no need to wear masks. Only if you're going to any crowded places, contact with a sick person, or going to any hospitals where there may be flu-like cases, then alone masks are advised.
We don't have to wear a mask and go to office.
Mask can go to office, yes.
Okay. So government has done a very good job, I think in India at least now. They have even stopped the visa issues and the entry of the foreigners into the country. Have they done enough, or you think they should have done much more than what they have done?
No, they have done it at the right time when the number of cases are increasing. I think that's a welcome step actually to contain the infection coming from outside the country. That is one. And then they've started pre-call message about the coronavirus, trying to educate the masses and different people. Earlier it was coming only in English. Now I think it is coming in the local languages as well. Actually, we have started listening that message in the Telugu as well. So that pre-call messages, and I think the media is doing its job in trying to educate the people. So there need not be any panic or excess concern among people, but at the same time, precautions and appropriate measures need to be taken to contain this infection.
What are the general readiness hospitals should be? At this point, there are only designated hospitals which are admitting, but if it becomes epidemic, what should basically a hospital should have to accommodate these patients?
Every hospital should have a method to screen the patients
At the entry
point itself, like put up counters saying any patient having symptoms of flu should report at that counter, and then a detailed history must be taken regarding any travel history or if they had any contact with a suspected or confirmed case of COVID, and such patients should be made to sit in a separate area. There should be an isolation room available where detailed evaluation will be made by the doctors, and then a decision needs to be made on whether they need to be admitted or
so if they are admitted, they should have specific isolation rooms?
Yes, isolation ward should be created with all proper PPE, supplies, everything available, and the staff there should be trained on isolation precautions and regarding donning and doffing of PPE.
So the isolation room should have an independent airflow mechanism?
Yes, ideally they should be negative pressure rooms, but if the facility does not have such provision, they can be well ventilated rooms, and with if they are air conditioned, then the exhaust should be blocked and they should be having a separate FC each room. It shouldn't be a common HVAC system, in which case there may be spread of infection to the whole facility.
So what all clinical readiness we should have? What equipments hospitals should be having before they think about admitting these patients?
So we should have, in case we have a separate isolation room, as Madam has said, I think that is a welcome measure. But it also depends upon the number of cases and the availability of rooms, single rooms in a hospital actually. You have more number of cases, then you should have ideally 2 isolation wards. One for keeping patients who are suspected to be having a coronavirus infection, and 1 ward for patients who are having a confirmed coronavirus infection, so that there is no mixing among patients who are suspected and who are confirmed cases.
So critical isolation rooms, when a patient becomes critical, then they also have to be in a critically well equipped isolation rooms. What are all the equipments they require?
So there should be an isolation room with a negative pressure room, which should have 12 circulations of air at least, and then the
availability of ventilators and NIV.
The patient, there should be personal protective equipment for the doctors as well as the nursing personnel, and then we should have all the mechanical ventilators, non-invasive ventilators which are available, monitors, and the dialysis machines. Everything should be available, because these patients can land into multi-organ dysfunction syndrome and can require support to an extent like an ECMO also. ECMO is extracorporeal membrane oxygenation, where even when the ventilator does not work, this can help us in tiding over the crisis sometimes.
So ideally, a hospital who has all these equipment supports will be ideal place for a patient to be admitted, especially susceptible patients to be admitted for treatment of coronavirus.
And in such situations, the medical equipment should be dedicated for such patients.
They should not be used for another patient. And probably once it is used on this patient, they have to be thoroughly disinfected before it is used on some other patient. And most of the tubings, etc., should be disposed of. So is there any scope for panic? Is it really going to spread in a big way, or you think that it's going to get contained by itself over a period of time?
Currently in India, I think there is no need for panic. The number of cases are close to 100 or so. Considering a population of 1 billion population, 1.2 billion population, 100 people are affected. And now, as of now, all the people are aware of all the measures which need to be taken. There is no need for panic at the moment. Only appropriate precautions need to be taken to prevent further spread, containment of the infection to the clusters which have been identified in different places is the way forward, I think.
So the message is, we don't have to panic, but at the same time, don't be complacent. Take necessary precautions in trying to avoid probably going into crowded areas, going into areas where the disease has already been there, avoid traveling, and trying to be at home in case if you find some symptoms related to that with a contact with a positive patient.
Yes.
So is that the message?
Absolutely.
Okay, thank you, Dr. Pragathi and Dr. Vishwanath. And so that's the message, that we should not be panicking about this, and at the same time not be complacent, and then take necessary precautions to prevent the spread of the disease. Thank you.